Okay, I just sent the link to the group chat now. I expect that by now people would start joining.
Okay, so are you expecting a large number of people? And
the time that we specifically chose for this particular episode, I'm not very certain how much number of persons we can expect. Usually people join webinars around 8 p.m. here.
yeah,
And 8 p.m. here would be very late for you over there. So
yeah, it will be
we'll just
10
give it.
p.m. Yeah.
Exactly. Okay, let me try sending some messages to them in the group chat. Okay, I think we have some persons joining us now. Okay, we're just going to give, for those of us who are already in the call, we're just going to give some minutes for others to join, so we get more viewership on YouTube.
Okay.
Okay, I think we'll be starting as soon as it is 4 now. Okay, hello everyone, and a very warm welcome to the PharmaGenoXfE interview series. This is the first episode of the series, and if you can hear me clearly, please just type yes in the chat. Let me know if you can hear me from YouTube. From those of us on YouTube, if you can hear me, just type yes in the chat box. While we're doing that, you can also just kindly tell us your name and the country from which you are joining us. If you like, you can include whether you're a clinician, a pharmacist, a student, a researcher, or simply someone curious about pharmacogenomics. Okay, okay, you can hear me. Thank you so much. I can see Gina and the chats. Thank you, thank you. While doing that, just drop the country from which you are joining us from. Um, as we mentioned during the publicity section, we said that this session is pharmacogenomics beyond borders, right? So we want to see the diversity in the house. Okay, I see Patience in the house. Welcome, Patience. Thank you for joining us. I see Messi Issa. Thank you so much for joining us. Okay, Gina is joining us from Nigeria. Thank you so much, Gina. Keep it coming, guys. Keep it coming. Messi is joining us from Nigeria too. Welcome, Messi. Welcome. Patience is joining us from South Africa, a pharmacy student. Welcome, Patience. It's nice to have you join us. I see Kefas from Niger Republic. Kefas, welcome. Nice to have you join us. Let's keep it coming. Let's keep it coming. Very soon, we'll be diving straight into the interview session. And during the session, we're going to be unveiling a lot of things. I see Teresa from Nigeria, a researcher and a veterinarian. Thank you so much for joining us, Teresa. I see Kennedy Owino. Kennedy is joining us from Kenya. Welcome, welcome, Kennedy. Nice to have you join us. Let's keep it coming, guys. Let's keep it coming. This is exactly why we do this. We already have people joining from different regions of the world, and that perfectly reflects today's conversation, being pharmacogenomics without borders. Now, a very quick housekeeping rule to note before we proceed. If you're enjoying the session, you've enjoyed any of our sessions in the past, please subscribe to the channel and turn on the notification bell to ensure that you don't miss future live sessions and replays. Your engagement directly supports us to ensure that we keep giving these kind of conversations for free and make them globally accessible. Okay, thank you so much. Messi, a medical student from Nigeria. Thank you so much. Thank you so much. Thank you so much. So right now, I'm going to be giving us some brief overview about what PharmaGenoXfE does and the space we occupy in the healthcare space. PharmaGenoXfE is an initiative committed to advancing awareness, education, and dialogue around pharmacogenomics, pharmacogenetics, precision medicine, and digital health. Over the past years, we've hosted free international webinar series and live sessions featuring experts from multiple continents, engaging participants across 30 plus countries. Our mission is simple: to simplify complex science, inspire early career professionals, and promote inclusive, global, relevant healthcare innovations. Today's session is designed to be very conversational, not the regular kind of lectures we have. So please keep your questions coming in, like I mentioned in the WhatsApp waiting room. Keep your questions coming in the chat box, and when the time comes, we will be attending to all of them. Now, it is with great amount of pleasure that I introduce our guest for today. Our guest for today
I can't hear you, Destiny.
Yeah, sorry about that.
Mhm.
So I'll be introducing our guest speaker for today. I was getting some noise in the background. So our guest speaker for today is Professor Nancy Hakooz. I sorry if I mispronounced that, Professor.
That's
Professor
right.
Nancy is a professor at the School of Pharmacy, University of Jordan, and has served in that role since 2012. She is also the founding dean of the Faculty of Pharmacy at the Zaka University and later served as its vice president. Her research focuses on drug metabolism and pharmacogenetics in the Jordanian population, with over 60 publications in leading international journals. In recognition of her outstanding performance and contribution, she received the ISSX Award for Outstanding Achievement in Xenobiotic Research by a scientist from an underrepresented nation at the ISSX MDO 2022 meeting in Seattle, United States. Beyond titles and achievements, Professor Nancy is widely respected as a mentor, a leader, an educator, and a role model. Professor Nancy, thank you so much for joining us today. You're very, very welcome.
Thank you, Destiny, for the nice introduction. I am really excited to talk about pharmacogenomics without borders with you and the rest of the people that are joining us today.
Thank you so much. Now, I would be moving straight to the interview session. Professor, before we talk science, I would love to start with you. How has pharmacogenomics been for you? Or how did you first discover pharmacogenomics? Was it something that was always planned, or did the field just find you along the way?
Thank you, Destiny. I think when I go back to the time where I started pharmacogenomics, I have to say that I wasn't trained to do pharmacogenomics. I was trained, I did my PhD in the UK, in Manchester, and my work was on drug metabolism and kinetics. And basically, we worked on in vitro, in vivo models on rats. So this type of work was very, very expensive, and it is something that I couldn't do back here in Jordan. So I was thinking what kind of other things that I can do, what is unique to Jordan, something that I can do and I can get the publicizing Jordan outside our country. So I was introduced by my former supervisor to somebody from the UK. His name is Professor William Newman, and we started doing pharmacogenomics. So this was basically the first time I knew anything about pharmacogenomics, and luckily enough, we had some data. We did work on TPMT, and we had some data, and we were able to publish that. So when I started discussing with different people what kind of things we can do in Jordan, pharmacogenomics was something that is getting into everybody's, let's say, agenda. So I thought maybe pharmacogenomics is the way to go. So I started doing bits and pieces here and there. And from there, everything just rolled. And I am basically doing pharmacogenomics now in Jordan. So no, I didn't plan this for a long time. It's something that I stumbled on, if you want, and I kept going after that. I did my PhD before actually pharmacogenomics was introduced into the clinical practice or even in the pharmacy practice. So basically, my introduction, as I said, it was purely by coincidence, which is, I think it is a nice coincidence. I like it. So from there, I just did more and more. And every time I try to do something different, try to get things into pharmacogenomics and in terms of research or clinical application, I discovered that we have a lot of things to do, not only in Jordan, but worldwide regarding pharmacogenomics. So I wish I could say yes, I was planning to do that, but no, it was something that I stumbled on while I'm trying to find something that I can do uniquely in Jordan, and Jordanian population are unique to Jordan. So that's why I started with pharmacogenomics.
Fantastic, fantastic. You know, I can't agree with you more, especially when you say that there's a lot to be done in terms of doing pharmacogenomics, not just in Jordan, but globally. There's a lot to be done, and that's one of the reasons why organizations such as ours organize these webinar series and make them free to ensure that we get more people into the boat. Thank you so much, Professor. I would move straight on to the next question now. What would you say excites you the most about pharmacogenomics as it is now compared to when you started your career?
I want to just echo what you said about doing these type of webinars being free and accessible to everybody, because I think one of the biggest hurdles that we have when we talk about the implementation of pharmacogenomics is basically education, having more people aware of the importance of pharmacogenomics and how can we use pharmacogenomics to improve clinical care. And I think this is the major difference between when I started pharmacogenomics. It was really to know, are we different? Do we have something that we can say that as Jordanians, we are different from the global population? Are we the same? Do we need to do more work to prove that we are similar or we are different? This is the first thing that excited me at the beginning. But now I think what excites me more is the prospect of getting this into clinical care. And I know that if we know more about Jordanian population, exactly because we are talking about Jordan, or we know globally about a lot of the pharmacogenomics variants that are present, we can move ahead with the implementation. And this is the whole idea. We want whenever we do research, why do we do research? We do research for several reasons. One of the biggest reasons as pharmacists, for example, as healthcare provider, to provide better care. And I think this is the way to provide better care. This is one of the ways to provide better care. So what excites me now that I think because we know more, clinical implementation is the way to go. And I think this is one of my biggest goals to basically to introduce pharmacogenomics in clinical practice in Jordan and hopefully throughout the region and globally.
Fantastic, fantastic. Thank you so much, Professor. So before we begin to dive deeper, I'd like us to take the gear back again and then consider members in the audience who probably may be hearing the term pharmacogenomics for the first time. I would need you to explain pharmacogenomics in the simple way, in practical terms that these people can relate to.
Pharmacogenomics is a term that takes into account pharmacology and genomics at the same time. So basically, it is a science that explains or tries to explain why there are differences between individuals in terms of response to medication. Why certain people will take, if you have a group of people with similar diagnosis, we give them the same drug, the same dose of the drug, and we find people that basically benefit from that drug and others will not. And it's not only getting the benefit, and sometimes some people will have side effects, others will not, for the same medication, for the same dose. So we are trying to explain why we have differences in the drug response, drug toxicity, efficacy between different individuals based on their genetics. Pharmacogenomics is one of the biggest, let's say, players when we talk about personalized medicine. Personalized medicine is one of the ways by which we can tailor medication depending on the different individual. We say that their genetics, taking account if they have comorbidities, if they're taking other types of medication. Now, if we talk about all of these at the same time, we're talking about personalized medicine. So pharmacogenomics is a very important part of personalized medicine. Have we lost Destiny? Can you hear
I'm
me?
here. Yeah, very, very loud and clear. Fantastic. Thank
Yeah.
you so much.
Okay.
Thank you so much. So we'll move to the next question now. Can you give an everyday example that some of these participants can also relate to? Just an everyday
Yeah.
example.
Now, if we talk about, let's say, as a pharmacist, I'm sure that all of people know that when we talk about statins are medication that are used to lower the cholesterol concentration or the level of cholesterol in the body. Now, some people will take statins and they will have no problems. Others will take some certain types of statin and they will have muscular problems. They will have issues because they will have muscle pain. So one of the ways what we can explain that this difference is basically pharmacogenomics. One of the transporters that are important. Certain people, if they have mutations in these transporters, they will have more chance of getting muscular pain. Now, if you talk about clopidogrel is a medication that is used it's anticoagulant. People use it when they have problems and they need, for example, after certain types of surgeries, they need to take clopidogrel. Some people will benefit, others might have episodes of bleeding, others might have no effect at all. And the reason for that, again, it's pharmacogenomics. So when we talk about examples, we have examples all around the place. When we talk about different medication, maybe the biggest, let's say, group of medication are drugs that are used in oncology. A lot of these drugs, certain people will have serious side effects, and these serious side effects might lead to death, and others might not have any serious, let's say, they will have side effects, but much less side effects, again, because of their genetics. As I said, this is part of the what is called personalized medicine. And when we say personalized medicine, we think this is like a new thing that is happening, a new topic. It's not a new topic. It has been there for a while. When you talk about, for example, blood transfusion, do we give the same blood for everybody? We don't. Depending on the blood type, we give the certain, let's say, blood type so that we have will not have any problems. So it's the same, but getting more, let's say, players into the actual medication. Genetics, comorbidities, as I said, different types of drugs, physiological factors, all of these should be considered when we talk about personalized medicine.
Fantastic. Thank you so much, Professor. My next question is going to center around population diversity and global health. It is one thing that we deeply care about at PharmaGenoXfE, and that thing is representation. Many drug studies are conducted in limited population. Why do you think this is a problem from a global health perspective, Professor?
Yeah. Now, a lot of the medication that we use in different countries, they are studied in populations from European descent. We're talking about different studies done in Europe or in the States, and basically they look at the drug response based on their genetic makeup. Now, when we take this medication and we give these medications to different individuals in different parts of the world, we expect that the medication will be the same. It's not. Now, when we talk about global populations, we have different types of alleles or mutations, and these alleles or mutations might have an effect on the drug response, on the drug toxicity, and this is basically, it's not represented when we talk about the guidelines that are present from countries like, again, from the Europe or from the States, because they base the guidelines on the allele frequencies that they have in their populations rather than what is globally present. Now, one of the biggest reasons, because we don't have a lot of studies, global studies, when we talk about the different variants. And this is the role of pharmacogenomics across borders. We need to include more diverse populations when we talk about the frequencies and the different alleles, and we need these to be introduced as part of the guidelines that are present from different societies. And this is important because, again, if we know these variants in the different populations, we can increase the diversity, we can have more equity in terms of drug medication, and hopefully we'll reach what we want, what our goal as healthcare providers, to provide the best medication with the lowest side effects.
Fantastic. Thank you so much, Professor. I'll move straight to the next now. What type of adverse drug reactions could realistically be avoided with wider use of pharmacogenomics?
I think we need a whole lecture for that. A lot of the things can be avoided. We can start. Number one, it can be we can have better effect of the drug if we have pharmacogenomics before actually prescribing the medication. We can lower the side effects of the drugs. Side effects, as I said, they can be quite serious. For example, sometimes it might lead to death, but sometimes side effects can be very, very, let's say, unavoidable side effects, and they can be avoided. For example, if we talk about side effects such as vomiting, diarrhea, these are we consider these as a very low, mild side effects. But if we can avoid them by pharmacogenomics, why not? We can also lower the trial and error. A lot of the medication, we know that we usually change the medication depending on if we are finding what the effect that we want. If we have, that's it, mumtaz, that's good. If not, we need to change the drug. And this trial and error can be reduced when we introduce pharmacogenomics. As I said, pharmacogenomics can provide a solution in terms of what? In terms of getting the best medication with the lowest side effects in the smallest amount, or let's say the smallest time possible. And this is very important when we talk about pharmacy practice and clinical care.
Exactly. And just a follow-up question to that, Professor. Some time ago, I was in a gathering and I was speaking with someone about the impact that pharmacogenomics implementation could have on the entire healthcare system in terms of cutting down the cost of the healthcare system. And I think this is something that we often do not discuss enough. We often do not make very loud. So my follow-up question is going to be, what do you think could be the cost of not implementing pharmacogenomics in clinical practice?
As I said, if you have more side effects, people might not adhere to medication. For example, if we're talking about statins, we know that people will not use their statin as they should because of the side effects. Sometimes we waste medication because we are trying something that is not working. For example, clopidogrel, it is a drug that needs to be activated in the body. So if somebody takes the drug and they can't activate it, so they will take the drug for a long period of time and they will not benefit. So this is waste of medication. We can also have more, let's say, savings if we have less hospitalization. And this can also be done with pharmacogenomics. If we have less side effects, less hospitalization will be there. Other than we talk about economical burden, we talk about healthcare systems. We have limited resources. So if we have these limited resources and we can tailor our resources, we can target our resources to what we want to reach, basically we can save a lot of medication. As I said, our healthcare providers, our healthcare systems around the world, and maybe it is much more when we talk about middle and low-income countries, we have limited resources. So if we have pharmacogenomics, I'm sure that we can use these resources better because we'll have less medication waste, we'll have less time for the trial and error, we'll have less hospitalization and less side effects, to be honest. And this is what we want at the end.
Exactly, Professor. Thank you so much. I think my next question is probably one of the most important questions we're going to be taking for this session. And that question is one that I get asked, especially after free webinar series like this when we organize them. I get people come into my DM and get asked questions about, oh, what can I do to be a pharmacogenomics expert? What do I have to start learning now to be able to go into the field? Or, oh, I have this research that I'm doing. How can I implement pharmacogenomics into what I'm doing? So my question is going to be, what would be your advice to these pharmacy students, these medical students, these biomedical students who are watching today, who perhaps want to go into this field or want to implement this the technology from this field in one way or another in their work? What would be your advice to them? And then what common mistakes do you see young researchers make these days when entering into this space?
This is a very nice question, Destiny, and I think this is a question that I always get whenever I lecture about pharmacogenomics, even in Jordan. I think the first advice for everybody that wants to get into any type of research: be curious, ask questions, try to understand why things happen, read a lot, because reading a lot basically will help you understand things better. If we're talking about pharmacogenomics, I think having principles of genetics and genomics is very important. Also being good in therapeutics, knowing the pharmacological effect of drugs, why drugs, what kind of, let's say, what kind of side effects you might get with drugs is very important. And I think one of the biggest mistakes that the students do they want to solve all the problems at the same time. All the things that they think that are problematic, they want to answer it with one research question, with one research project. And this is not the way. Research, similar to education, it is a building process. And basically, everybody does part of the work where we can, together, we can formulate. And I always say that research is similar to making a puzzle. When you do the puzzle, you have like certain segments, parts that you put together in order to see the big picture at the end. And this is the same. Try, as I said, try to be patient whenever we do the research. Big ideas, big questions are always acceptable, but we cannot answer these questions directly. We have to take them step by step in order to reach what we want. And I think doing things like this, because we're talking about clinical practice, one day I am sure some of the people that are listening, they will have the capability to implement, to be the advocates for implementation. And one of the biggest problems, we know this in, let's say, in research settings in universities, but maybe we need more into clinical practice, and we need policymakers to understand the importance of this and to be our advocates. And hopefully one day, some of the people that are listening, they will be in a place where they can change a policy. They might be, let's say, they can be in hospitals, in administration. They can be the Minister of Health, or they have some role that can basically implement the clinical, or can help implementation of the pharmacogenomics. So it is, the biggest mistake is trying to do a lot at the same time. Just take your time, and make sure that you can understand all the principles. But I think in pharmacogenomics, similar to any type of research, you need basic skills: reading, thinking critically, having communication skills, trying to attend as much as you can lectures, seminars, and things are getting easy these days. After COVID, we can do things online, which is something that we couldn't do before COVID. So this is one of the biggest, this is not the biggest, this is the only advantage out of COVID, that we can connect through the online and have lectures through online. So this is my biggest advice: be curious, take things slowly, and read a lot. Try to listen, try to attend as much as you can to understand this type of, let's say, research more and more.
Amazing, amazing. Thank you so much, Professor. I can't agree with you more. We need to do more. We really need to do more, especially in the area of policy. I believe that's one critical area that we need more persons to delve into. And I'm very certain that with the help of very respected experts like you, who go about sharing this knowledge for free to persons across the globe, we would certainly get there. Thank you so much, Professor. And just a quick reminder to everyone watching, please like this video, subscribe to the channel, and turn on the bell icon. It helps us, certainly helps us to grow and continue to do more and more of this. So we're about wrapping up now. Professor, I'm going to ask for your final words, your final message that you're going to be leaving with the audience today, and how can people follow your work or learn more about you and about the things that you do, especially in Jordan?
Yeah, I think my biggest advice, or let's say message at the end, that pharmacogenomics is very important. And getting this into clinical practice is one of the ways that we can improve patient care. And saying this, pharmacogenomics is not the magical solution for everything. Not because we are introducing this, people will not have side effects. People will not benefit from that. No, we will still have some people doing that. But again, I'm saying it's the biggest advice, or let's say message that I want to leave with everybody. This is a very important discipline, but it is not the magic solution for every side effects that we have. And in order to follow, just you can follow my profile on LinkedIn, on Facebook. Usually when I have some publication, I publicize this on LinkedIn with the people that I do the work with. You try, not only my work is important, because I'm talking about Jordan, but I think you are doing a lot of important work in Africa, and you can follow certain scientists that do some similar work in Africa. Follow let's say the international bodies that are important in terms of pharmacogenomics. We saw, for example, PGRN, the Pharmacogenomic Global Research Network. They have a lot of lectures. Every month, I think they have one of these presentations. For example, if you can attend conferences, if you can go for conferences that are again in Africa or even in Europe, this is very important. Follow the big players when we talk about pharmacogenomics. For example, CEPIC, which is the Clinical Pharmacogenomic Implementation Consortium that basically provide guidelines. You can follow ClinPGX. This is a website basically based on the voluntary work of people that are very enthusiastic about pharmacogenomics. So I think the sky's the limit when we want to learn more and more, because you have so much resources available, and these resources, again, as I'm saying, after the COVID, these resources became more and more available online. So we can use this. My advice for everybody, stay curious and try to learn more. And I think if everybody thinks this is their responsibility, we can move pharmacogenomics more and more into clinical practice.
Amazing, amazing. Thank you so much, Professor. Thank you so much. It's been an honor. It's been an honor. I'm seeing a question in the chat, but I don't think that's for Prof. That's from Patience. Patience, I think Patience from South Africa. If you can reach out to me, Patience, via the WhatsApp waiting room, please do. I would get to attend to that. Thank you so much, Professor. Thank you so much for sharing your journey, your insights, and your inspiration with us today. This is truly been an enriching conversation. We are very grateful. To everyone watching, thank you for your time, your questions, and your engagement. Please stay connected with PharmaGenoXfE, share this session with colleagues and friends, and join us for future editions of the PharmaGenoXfE live interview series. This is just the first episode, and we're going to be making announcements of the second episode, as well as bring you another very amazing experts. Thank you so much once again, Professor. Thank you, thank you, thank you. It's
Thank
going to
you,
be a wrap
Destiny.
for today.
Thank you, Destiny,
Thank
and
you so
thank
much.
you for hosting me, and thank you for this platform that hopefully will engage more with the audience in the future. And I hope all the best for the coming new year, and hope to see you again next year, 2026. Thank you.
Same here, Prof. Same here, Prof. Thank you so much. Thank you so much. All right, guys. Thank you so much for watching. We'll wrap it up here today. See you in the next edition. Like I mentioned earlier, please do well to subscribe to the channel, like our videos, and share with your colleagues and friends. It really helps us to do better and more of this. Thank you, thank you, thank you. All right. Bye bye,
Bye.
Prof.
Bye.
Yes.